Is your hairline also receding in an M shape? If yes, then now is the time to take action, because this is where the hair loss usually begins, and with time, it can progress into any stage of baldness. And when you start looking for the permanent solution, taking all the home remedies and medications, by then, you have probably lost the frame and charm of your face. This is what most of our patients faced before opting for a hair transplant. In this video, we are going to share the journey of our 3 different patients who had been struggling with the different grades of baldness. One had a baldness of grade 2, the other one had grade 3, and the third one had a diffuse grade 4 stage of baldness. A bit advanced stage of baldness compared to the first 2 patients. What was common in all 3 patients was that their hairline had receded in an M-shaped pattern, and they were all in their early 30s, where confidence and good looks matter the most as society starts judging your age according to your baldness. Now, let's take you through their complete transformation journey, from planning and hairline design to the final results. Stay tuned till the end to see their amazing results. When our experts initially met the patients, this was how they looked. Their hairline had receded in an M-shaped pattern, and only the frontal tuft retained a few healthy follicles. As the hairline receded in an M-shaped pattern, it made the frontal area visibly sparse on the sides, or we can say, except frontal tuft, the entire affected frontal area appears empty for patient 1 and patient 2. In the patient 3 case, the entire frontal area was affected by thinning along with the sparse sides, which resulted in the loss of his overall facial frame. The area that our experts focused on treating for patient 1 and patient 2 was their hairline and frontal area. But as patient 3 had a bit advanced stage of baldness, as mentioned earlier, for him our experts focused on treating his hairline, temples and frontal area. Along with these areas, his crown region was also affected by the thinning. It has retained its swirl patterns but appeared less voluminous. What was most necessary to treat their baldness was a good donor area, the part of the scalp where healthy hair follicles are extracted from. After examining their entire scalp, our experts found out that patient 1 has a dense donor area, while patient 2's donor area visibly appeared less dense, but it had plenty of healthy follicles. Again, patient 3 had a dense donor area where follicles were closely packed. Utilizing their healthy donor areas, our experts planned their hair transplant and carefully performed the procedure without any severe complications. If you are also facing such challenges, then share your scalp pictures with our experts and they will guide you on what suits you best, a hair transplant or a medication. Once the initial consultation and baldness examination were done, our experts moved on to the next step, which was hairline design. Before designing their hairlines, our experts trimmed their hair and provided them a scalp cleansing session to remove dirt, excess oil, and dead skin cells, which ensured a clean surface for accurate markings. After that, the hairline was designed, considering their facial features. For patient 1, who had a broad forehead and a round face, a custom-shaped hairline was designed. The distance of the hairline was measured from the glabella point to ensure symmetry and natural balance. Along with the hairline, the affected frontal area was also outlined for implantation. Patient 2 also had a round face with a slightly narrower forehead as compared to patient 1. His hairline was similarly designed after measuring the distance from the glabella point. However, his baldness was slightly more advanced, with greater hair loss in the frontal region, which placed him in the grade 3 category. His hairline and entire frontal zone were carefully outlined for treatment. Patient 3 had an oblong face shape and a wide forehead, similar to patient 1. His hairline was crafted according to his facial proportions. Along with the hairline, his temples were also designed to frame his facial contours and bring back the overall facial frame. The frontal area was also outlined too, as it also has less volume, and the crown region was separately encircled for grafting, as it retained the natural swirl but lacked volume. These carefully designed outlines defined the recipient areas for each patient and served as a clear roadmap during the procedure, helping the surgeons to achieve natural-looking results. Once the hairline design was finalized, the procedure began by injecting local anesthesia in the recipient and donor zones to make the procedure painless. Then, the slits were created in the recipient area, which is an important step in a hair transplant that determines the density, angle, and direction of the new hair growth. It ensures the transplanted hair looks natural with the existing hair. Well-made slits also shield the grafts and increase their survival rate. By doing this, surgeons can avoid an artificial look and form a hairline that appears natural. In short, the formation of the slit is the foundation of the success of the procedure from an aesthetic and medical perspective. Then, the extraction and implantation began. For patient 1, to restore his hairline, single and thin hair follicles were implanted in an irregular pattern to create a natural look. To enhance density in the frontal area, double and triple hair follicles were implanted, creating a fuller look. In his case, a total of 2,700 grafts were implanted, all extracted from the patient's safe donor zone. Patient 2 had almost similar baldness. The frontal area was more affected in his case. Just like patient 1, to create a natural-looking hairline, single and thin hair follicles were implanted, and to add density in the frontal area, double and triple hair follicles were implanted. In his case, a total of 2,937 grafts were implanted, all extracted from the patient's safe donor zone. Although there was not a huge difference in the number of grafts implanted in the patient's 1 case and patient's 2 case, only slightly more grafts were implanted to cover the additional thinning in his frontal region. Patient 3 had a more advanced level of baldness and needed restoration in multiple areas. To restore his facial frame, our experts implanted single and thin hair follicles in the hairline zone and temples to create a soft appearance. In the frontal area, to add volume and density, double and triple hair follicles were implanted. To restore the volume around the swirls, same follicles were implanted at different angles to enhance density and volume. In his case, a total of 4,600 grafts were implanted, all extracted from the patient's safe donor zone. If you want to know more about the hair transplant procedure, then comment hair transplant. Patient 2 and patient 3 visited the clinic 1 month after their hair transplant for their scheduled follow-ups, for which their observation are as follows. Patient 2 had experienced around 40% shedding in the transplanted area, whereas his native hair was growing at the natural pace. There were no signs of redness, swelling, or infection on his scalp. Healing was going smoothly. His donor area has also healed completely, even with the short hair. There were no visible signs of scarring present, which is a sign of a well-executed transplant. On the other hand, in this 1 month, patient 3 experienced about 70% shedding in the transplanted area, which is completely normal. On his scalp, there were also no signs of infection or redness, and the healing was progressing well. His donor area had also healed completely, but minor gaps were still visible there, which can be filled in the coming months as the hair continues to grow and thicken. During this 1-month visit, both patients underwent their first PRP session. This treatment helps activate the hair follicles and supports new hair growth. It works not only on the transplanted hair, but also strengthens the existing natural hair. Besides PRP, you can also opt for more advanced treatments after hair transplant, which help nourish your scalp. The 2 advanced treatments available are GFC and QR678. Apart from PRP, which can also be chosen for better results, or even if you're noticing hair loss at an early age, these therapies might be useful. GFC, growth factor concentrate, is an upgraded version of PRP. It is more refined and concentrated, which makes the results more consistent and effective over time. QR678 is the most advanced therapy among the 3 treatments available for hair regrowth. It uses a blend of growth factors, which are very effective even in stubborn and resistant hair loss cases. This therapy reduces hair fall and promotes the growth of new hair. These treatments are not just useful after a transplant, they can also be started early if you're noticing signs of hair loss to help prevent further damage and support healthier hair growth. If you want your hair loss not to change into baldness, then start taking these hair regrowth therapies, which would help you out. To know more about them, give us a call. Our experts will assist you. All 3 patients visited the clinic for their follow-up 3 months after the hair transplant. This was the first visit of patient 1 after the hair transplant, while the second visit was of the patient 2 and patient 3. By this stage, the healing process was well underway. Here's how their progress looked after 3 months. Patient 1, who has visited for his first follow-up, showed encouraging progress. During the examination, our experts observed that the shedding phase was near its end, as the implanted hair had mostly shed, which is a part of a growth cycle post-transplant, and now the scalp was preparing for new growth. The native hair had grown maturely and looking healthy. The healing in these 3 months had been exceptional. His donor area had also become completely undetectable with no sign of extraction, a proof of an advanced treatment performed at QHT. Patient 2 also showed good progress in his second follow-up. His shedding phase was also almost over and scalp had healed well. The follicles were now beginning to settle into the growth phase, which meant new hair would soon start to push through. Till now, the progress was on track. Patient 3 also gone through a similar recovery pattern. His shedding had also came to an end, and scalp was healing as expected. Since his baldness was at a more advanced stage compared to the other two patients, he had experienced more visible shedding in the early weeks, but by the third month, that phase had completed. The newly implanted follicles were now entering the early growth phase and some soft baby hair could be seen emerging in a crown region. His donor area, too, had healed well, and now no scarring was visible. The shedding phase mostly lasts for 3 months after the transplant. During this time, the implanted follicles go through a resting phase before they begin new hair growth cycle. All 3 patients continued their supportive PRP sessions. These sessions are important at this stage because they nourish the scalp and provide essential nutrients to stimulate healthier and faster regrowth. This 3-month follow-up is an important milestone in the hair transplant journey. Although the visible transformation is still a few months away, the foundation has been laid and the process of hair regrowth has already begun from within. At this stage of the hair transplant journey, all 3 patients had made noticeable progress. Patient 1 and Patient 2 visited for their 5 months follow-up, during which a mature growth was visible on both patients' scalp. By this time, the shedding phase had long passed and the follicles have successfully transitioned into the growth phase. While results can vary from person to person, the improvement in their appearance was quite visible and encouraging. Patient 1 showed a very positive change. His hairline had started to form properly and providing a defined look to his facial features. The frontal area, which earlier looked sparse, now displayed mature and healthy growth. The newly transplanted hair had started to blend well with his native hair, creating a natural appearance. The density was still in progress, especially on the sides of the frontal zone, which looked a little lighter, but this is quite normal at the 5-month stage. These areas usually take a few more months to catch up in terms of thickness. Overall, the entire scalp was showing very good growth in just 5 months, and his transformation was clearly noticeable. His confidence had also started to reflect in the way he carried himself. Patient 2 also showed promising progress. His hairline was starting to take shape, but some gaps were still visible in between the newly growing follicles. The grafts had successfully entered the growth phase, but the hair was still thin and lacked the volume needed for a dense look. His native hair, however, had grown quite well and was helping in giving a slightly fuller appearance from a distance. The signs were positive, and in the next couple of months, the implanted follicles were expected to thicken and give a more uniform and denser look. At this stage, his hair looked better than before, and even though it was not yet fully developed, the early signs were encouraging. However, the third patient visited after 6 months for his next follow-up. Since he had a more advanced stage of baldness and had undergone grafting in multiple areas, including the temples and crown, the expectations were different. His hairline was forming well and showed results quite similar to patient 2. It had started to shape nicely, but the density was still not complete. The volume was missing in some parts, which is very common at the 6-month stage, especially in cases where larger areas were treated. However, his temples had taken a good shape and were now helping restore the natural frame of his face. This made his facial features look more balanced and youthful. The transplanted follicles in the frontal region had clearly transitioned into the growth phase, and while the hair was still in its early stages, the scalp was active and responding well. His native hair had grown densely and was helping improve the overall appearance. What stood out in patient 3's case was the improvement in the crown region. Both the swirls, which had appeared flat and less defined before, were now showing signs of new hair growth. The volume around these areas had improved, and the natural swirl pattern had started to come back. Although full density takes more time in the crown compared to other areas, the early progress was very promising. While the final results are still a few months away, the major changes have already begun. Stay tuned to see their results. Before revealing the results let's debunk some myths that hold you back from getting a hair transplant. The first myth is hair transplant is a painful procedure. This is one of the most common fears that stops people from taking the first step. But the reality is, hair transplant is done under local anesthesia, which means the scalp becomes completely numb and the patient stays awake but doesn't feel pain during the procedure. At most, you may feel mild pressure or tugging, but not pain. Once our patient underwent the procedure, they described it as surprisingly smooth and comfortable, and often said it was much smoother than they imagined. The second myth is transplanted hair falls off again. Many people think that the hair transplanted during the surgery will also fall out in the future, but that's not true. The hair that is transplanted is taken from the donor area, which is the back and sides of your head, the area genetically resistant to baldness. So once these hairs are transplanted, they behave just like your natural hair from the donor area. They don't fall off again. With the right technique and proper care, these hairs can last for a lifetime. We've just covered 2 common myths. Let's look at our patient's results before moving on to the next 2. The next visit of patient 1 was after 7 months, and when he arrived at the clinic, his scalp was full of healthy and dense hair growth. His hairline was perfectly defined and giving him an energetic look. The frontal area, which was previously sparse and patchy, had filled in with thick growth. There were no visible gaps left on his scalp, and the transplanted follicles had blended seamlessly with his natural hair. The density in the frontal zone was excellent, and the direction, angle, and texture of the new hair matched so perfectly with the native hair that it was nearly impossible to tell the difference. Anyone looking at him now wouldn't be able to guess that he had undergone a transplant. It looked as if the hair had always been there. It's important to note that these were not his final results. Hair growth after transplant continues to improve in terms of thickness, texture, and maturity over a period of 8 to 12 months. But even at 7 months, the progress in patient 1's case was far ahead of average. Patient 2 visited the clinic 8 months after his hair transplant, and the results were astonishing. In this period, his hair had gone through a major transformation. His hairline had now fully settled in and was beautifully framing his facial features, giving him a defined and balanced appearance. The frontal area has gained voluminous hair growth with the seamless merge of transplanted and native hair. There was no visible difference between the two, which made the results look completely natural. Even from a close distance, it was difficult to tell that he had undergone a transplant. The new hair growth was thick, healthy, and well distributed across the scalp, further enhancing his overall look. Now he can style his hair freely and confidently according to his choice, whether it is trying different hairstyles, changing his hair parting, or whatever he wants. This stage in his journey marked a major turning point. Not only had his hair density improved, but his entire appearance had become more youthful and refreshed. The results were clearly ahead of time, considering that most patients reach this level of growth between 9 to 12 months. And the best part is, his results will continue to improve even further in the coming months. Patient 3 visited the clinic for his next follow-up after 9 months, and his results were mind-blowing. The transformation in his appearance was clearly visible and incredibly satisfying. The hairline and temples have become completely defined, giving his face a sharp and well-framed look. The once receding corners and weak temple points had filled in beautifully, making his overall facial features appear more youthful and balanced. The areas that had initially appeared sparse were now filled with mature and healthy hair growth, creating a fuller and thicker look. The frontal area, which had been one of the most visibly affected zones earlier, was now filled with dense hair growth. There was a smooth and seamless blend between the transplanted follicles and his native hair, making the overall appearance look completely natural. You could no longer tell where the original hair ended and the new hair began. One of the most impressive parts of his hair progress was seen in the crown region, which initially lacked volume and appeared thinned. Now it looked full and well covered with the hair growth, especially around the swirl pattern. The even distribution of hair from the front to the back of the scalp gave him a balanced look. In these 9 months, his confidence had grown significantly, and he felt much better about his appearance. In 7, 8, and 9-month duration, this phase brought a drastic and highly visible change in the way they looked. Each of them achieved the kind of results they had once only hoped for. Their hairlines became well-defined, Their facial features were perfectly framed, and their scalps showed healthy, voluminous hair growth. The blend of native and transplanted hair looked completely natural, giving them a refreshed and confident look. Patient 1 visited the clinic 11 months after his hair transplant to showcase his final results, and the transformation was truly impressive. His hairline had become sharply defined and was now perfectly framing his facial features, giving him a balanced and youthful appearance. The frontal zone, which once looked thin and patchy, had now developed into a dense and voluminous area filled with strong, healthy hair. There was no noticeable difference between the transplanted and native hair, making the overall result appear completely natural. What made his results even more impressive was the consistency of hair growth across the scalp from the hairline to the crown. He now had complete freedom to style his hair in any way he liked, whether it was combing it back or trying out a trendy haircut. The confidence in his expressions and the satisfaction in his eyes reflected how happy he was with his final results. Though these were considered his final visible results, the quality and texture of his hair would continue to improve in the coming months, offering even better density and natural finish. Now, it's time to explore the next two myths. The third myth is, results are visible instantly after the transplant. Hair transplant is not a one-day transformation. It's a natural hair growth process. In the first few months, most people go through a shedding phase, where the transplanted hair falls, but only the shafts, not the roots. The new hair starts growing from the roots after 3 to 4 months, and the most visible results come between 8 to 12 months. So, it needs patience, but the wait is worth it, as you saw in all three patients' journeys. The fourth myth is the results look fake or artificial. This is completely untrue. Just look at the results of our patients with different grades of baldness and at different stages of their recovery. The transformation speaks for itself. At QHT Clinic, we design each hairline by carefully studying the patient's facial structure, age, and natural hair growth pattern. The direction, angle, and density of every graft are planned before implantation. The goal is not just hair regrowth, but restoring your overall look in the most natural way possible, without making it obvious that a procedure was done. All three patients began their hair transplant journey with different grades of baldness, but what connected them was a receding M-shaped hairline, which affected their appearance. However, the transformation they went through over the months shows how perfect planning and expert execution can deliver life-changing results, even when each case is different. But what's truly impressive is how each of them responded to the transplant in their own unique way. Patient 1 started showing visible changes by the 7th month. His results were faster than usual, and by the 11th month, he had a sharp, well-defined hairline and dense frontal coverage. His hair looked uniform from front to back, giving him a clean and natural appearance. His journey was smooth and quick, which is often the case in early-stage baldness with a good donor area. Patient 2 had slightly slower initial progress, but showed excellent hairline definition by the 8th month. His transformation gave him a very balanced look. The native and transplanted hair blended so well that even up close, no one could tell he had undergone a transplant. He now had the freedom to try new hairstyles and partings, something he had stopped doing before his procedure. Patient 3, with the most advanced hair loss, had the most dramatic change. By the 9th month, he had visible improvement not just in the front, but also in the crown area. His temples were well framed and the swirl in the crown had filled in perfectly. Compared to the other two, his journey required more grafts and more coverage, but the end result brought back symmetry, volume, and a youthful energy to his overall look. In this 7 to 9 month period, we saw 3 different baldness patterns restored with 3 different approaches, yet all led to one common outcome: a full head of hair and renewed confidence. While patient 1 showed faster results due to early intervention, patient 2 stood out with the most naturally blended look, and patient 3 impressed with the most extensive transformation, covering multiple zones. Together, their stories prove that no matter the grade of baldness, with the right planning, technique, and care, a successful transformation is always possible. Hair loss might start early, but your comeback can start even earlier. Patient 1 came to us with a visibly receding hairline, unsure if he'd ever be able to style his hair again. Patient 2 was silently losing confidence with each passing month, as his baldness became more noticeable. Patient 3 struggled with severe thinning from front to crown, which affected not just his appearance, but also how he felt in social settings. But what all three had in common was the courage to take timely action and the trust they placed in QHT Clinic. With the right diagnosis, expert planning, and advanced technique, their transformation wasn't just about restoring hair. It was about restoring confidence, personality, and identity. Today, all three patients stand with fuller hair, balanced facial framing, and a renewed sense of self. Their journeys prove that hair transplants are not just cosmetic, they're deeply personal. So, don't let baldness define you. Let your confidence take the lead. Your hair is not just about how you look, it's about how you feel. And just like these three patients, if you're experiencing early signs of hair loss or have already tried other treatments without results, now is the time to consult our experts. Send us your scalp pictures and we'll guide you toward the best solution. If you found this video informative, don't forget to give it a thumbs up and share it with someone who might need to see this. And most importantly, hit that subscribe button and turn on the notification bell